Hi, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're taking a really quick look at some new bills that were introduced in Wisconsin. We'll talk about what they're called in just a second, but we do have some links associated with this webcast that you can visit at any time by clicking on that information button that you see at the bottom of your screen. Now, the bills that were introduced are called the Healthcare Protection Package, and we'll talk about what that means in just a second. But it's important that you note that they were introduced by members of both the House and the Assembly here in Wisconsin. Representative Daniel Riemer and Senator Jon Erpenbach were named sponsors of these bills, and they introduced it on May 12th. Their rationale was to introduce bills to protect those in the state of Wisconsin from any possible changes made federally to the Affordable Care Act. They wanted to make sure that we could preserve some of the consumer protections that were put in place by the Affordable Care Act, even if the federal law changes. They call it the Healthcare Protection Package. They really could have called it the Consumer Protection Package as well. Now, what do these bills do? It was a series of bills, and they do things like prohibit lifetime and annual limits on insurance plans, prohibit pre-existing condition exclusions and rate setting based on pre-existing conditions from returning to the state, requiring coverage for preventative services and essential health benefits, all 10 essential health benefits that were part of the Affordable Care Act, and maintaining things like reimbursements for family planning providers in the Medicaid program. They spell out these 4 issues and a couple more in separate bills, saying if the American Health Care Act passes or some version of that at the federal level, Wisconsin wants to be committed to protecting pre-existing conditions and protecting people that need a little extra help and need all 10 of the essential health benefits. And also making sure that we don't have the return of terrible things like annual caps put on insurance so that you can only get a little benefit out of your insurance instead of all the care you actually need. Like we said, these were just introduced. They will get debated at some point in the state, and you could see it being difficult for a legislator of any side of the political spectrum from having to stand up and argue against some of these provisions. Why would you argue against the health of your constituents? So it really is holding some legislators' feet to the fire of why they support different elements of the American Health Care Act. Will be an interesting conversation. You can read the bills yourselves. We put the link to the full package there, and we also share a couple press releases with you, one of them coming out of Community Advocates Public Policy Institute saying these bills are a good idea. Thanks for joining us for this video case tip.